It's my pleasure to welcome you to the 43rd annual meeting. The theme today is about data. There's never been a more important time or more urgency to talk about data. Between new transparency requirements, you all having more of a fiduciary responsibility and expectations on employers as purchasers, the message is really clear. Data is not optional anymore, it is essential.
Every one of the claims you're looking at is a human life. And when you're looking at hospital data, more than any other kind of healthcare data, you are looking at life-changing moments in people's lives.
What we need is for businesses to acknowledge to Congress, healthcare is one of our biggest expenses, and it is growing faster than our ability to pay it. And if we do not course correct in the coming years, we will not be able to sponsor employee health benefits. And the result is that the government's going to have to pay for everybody's health insurance.
Even if your company won't put its name on something, come to Capitol Hill. Just the benefits person being in that room and talking to the member of Congress or their staff and just saying, I care about this, that's sufficient and significant. I think that it's a way for employers to engage without having to check 1,000 boxes that they won't be able to check to get approval.
It's my pleasure to present the 2025 BHC Business Health Culture Award to Pattonville School District.
Thanks to Joanne and the team here. They've really worked hard over the last couple years to put together a great program for our employees to improve employee wellness and getting our employees to school more and keeping them healthy. Because we know if the individuals that are providing the instruction aren't there to do that and aren't well, then our kids aren't going to have quality instruction every day, and it's going to impact their achievement.
Don't be afraid to ask questions. If something doesn't look right, dig into it more. Maybe there's something there, maybe there's not, but if it doesn't feel right, ask those questions, see what might be hiding, but that will also help give you that leverage when you're trying to negotiate or make the plans better.
Data isn't spreadsheets, data is a story. Yeah. And the better we get at telling the story, the more I think influential we'll be with our employees.
I'm really excited for where we're going to go as an employer voice in data, because I think it is the thing that will allow us to challenge the status quo in ways that individually we can't today.
If we could just make a 1 degree shift from where we are today to where we want to go tomorrow, that 1 degree shift becomes incredibly valuable, incredibly important. And then the next shift that capitalizes on the one that was previously made gets us to a better hope for tomorrow.
Again, a very warm thank you to everybody for being here today. It means a lot that you care about improving healthcare in our community. I think it was Josh said if we could just make a 1% shift in direction just now, right? Incrementally, we can start to make great changes. And it's not going to happen. It's not going to be a lightning bolt out of the sky and the world's going to be different, but it's going to be those unique opportunities to shift things by 1% at a time.